Question 1. Benchmark analysis indicates that when evaluating auditory evoked potentials (EEP) in a pediatric patient with a history of prematurity and suspected central auditory processing disorder, a technologist observes subtle but consistent delays in the interpeak latencies of the brainstem auditory evoked responses (BEAR), and a reduction in the amplitude of the middle latency responses (MLR). Which of the following approaches best reflects the appropriate interpretation and reporting of these findings? Option A. Focus solely on the interpeak latency delays in the BEAR, as these are considered the most reliable indicators of brainstem integrity, and disregard the MLR findings as potentially artifactual or less clinically significant in this context. Option B. Report the observed delays and amplitude reduction as significant findings, correlating them with the patient's history of prematurity and suspected central auditory processing disorder, and recommend further audiological and neurological evaluation. Option C. Prioritize the patient's subjective report of hearing ability, and if the child appears to be responding to auditory stimuli during the test, conclude that the waveform abnormalities are not clinically relevant and do not require further reporting. Option D. Interpret the observed waveform changes as normal variations for a child with a history of prematurity and central auditory processing disorder, and therefore do not report them as significant abnormalities. The correct answer is B. Report the observed delays and amplitude reduction as significant findings, correlating them with the patient's history of prematurity and suspected central auditory processing disorder, and recommend further audiological and neurological evaluation. Explanation. Scenario analysis. This scenario presents a common challenge in neurodiagnostic testing, where a technologist must interpret electrophysiological data in the context of a patient's clinical presentation and potential confounding factors. The challenge lies in accurately identifying subtle abnormalities in auditory evoked potentials, EEP, that may be masked or mimicked by non-pathological influences, requiring a nuanced understanding of both the physiological basis of AEPs and the specific clinical context. Ensuring patient safety and diagnostic accuracy while adhering to established protocols and ethical standards is paramount. Correct approach analysis. The correct approach involves a systematic evaluation of the AEP waveforms, paying close attention to latency, amplitude, and morphology, and critically assessing these findings against the patient's age, neurological status, and any reported symptoms. This aligns with best professional practice by prioritizing accurate interpretation based on comprehensive data. Regulatory frameworks for neurodiagnostic technologists emphasize the importance of accurate data acquisition and interpretation, ensuring that findings are clinically relevant and contribute to appropriate patient management. Ethical guidelines mandate that technologists act in the best interest of the patient, which includes providing precise and reliable diagnostic information. Incorrect approaches analysis. One incorrect approach would be to solely focus on identifying deviations from normative data without considering the individual patient's clinical context. This fails to acknowledge that normative data represents a population average and individual variations can occur, especially in certain patient populations or with specific physiological states. This approach risks misinterpreting normal variations as pathology or overlooking true pathology that presents atypically. Ethically, this could lead to unnecessary further investigations or anxiety for the patient. Another incorrect approach would be to dismiss subtle waveform abnormalities because the patient reports no subjective hearing complaints. While subjective complaints are important, objective electrophysiological findings can sometimes precede or exist independently of subjective symptoms, particularly in subclinical conditions or early stages of neurological compromise. Relying solely on subjective reports can lead to misdiagnoses. This approach violates the principle of thoroughness in diagnostic testing and could have significant ethical implications if a treatable condition is overlooked. A third incorrect approach would be to attribute all observed waveform changes to the patient's known neurological condition without considering other potential contributing factors, such as medication effects, fatigue, or even technical artifacts. This oversimplification can lead to an incomplete or inaccurate diagnosis. Regulatory guidelines often require technologists to identify and mitigate artifacts and to consider all relevant factors influencing test results. Failing to do so represents a lapse in professional diligence. Professional reasoning. Professionals should approach AEP interpretation by first ensuring proper electrode placement and impedance checks to minimize technical artifacts. Then, they should systematically analyze the obtained waveforms, comparing them to established normative data, while simultaneously integrating the patient's age, clinical history, and any concurrent medical conditions or medications. Any discrepancies or abnormalities should be carefully evaluated for their clinical significance, considering potential confounding factors. If uncertainty exists, consultation with a supervising physician or senior technologist is a crucial step in the decision-making process to ensure the highest standard of patient care and diagnostic accuracy. Question 2. Governance review demonstrates that a certified neurodiagnostic technologist is reviewing an electroencephalogram (EEG) recording and observes subtle rhythmic fluctuations in the electrical signal that differ from the expected background activity. The technologist needs to accurately interpret these fluctuations. Which of the following best reflects the fundamental understanding of the electrical activity in the brain that should guide this interpretation? Option A. The observed fluctuations are solely indicative of random neuronal firing and do not require detailed analysis as they represent normal background noise. Option B. The observed fluctuations are primarily a result of the summation of synchronized postsynaptic potentials from large populations of cortical neurons, influenced by their firing patterns and synaptic transmission. Option C. The observed fluctuations are most likely due to minor external electrical interference that can be disregarded if not significantly impacting the overall signal amplitude. Option D. The observed fluctuations are primarily determined by the gross amplitude of the electrical signal, with frequency and morphology being secondary considerations. The correct answer is B. The observed fluctuations are primarily a result of the summation of synchronized postsynaptic potentials from large populations of cortical neurons, influenced by their firing patterns and synaptic transmission. Explanation. Scenario analysis. This scenario presents a challenge in interpreting subtle variations in electroencephalogram EEG waveforms, specifically differentiating between normal physiological activity and potential artifacts or early signs of pathology. The technologist must rely on a foundational understanding of the electrical basis of brain activity and the factors that influence signal generation and propagation. Misinterpretation can lead to inaccurate reporting, delayed or incorrect diagnoses, and potentially inappropriate patient management. The professional challenge lies in the nuanced nature of EEG signals, where subtle differences can have significant clinical implications, requiring a high degree of vigilance and accurate application of neurophysiological principles. Correct approach analysis. The correct approach involves recognizing that the observed waveform characteristics, such as amplitude, frequency, and morphology, are direct reflections of the underlying synchronized postsynaptic potentials of large populations of cortical neurons. Understanding that these potentials summate and are influenced by factors like neuronal firing patterns, synaptic transmission, and the extracellular medium allows for accurate interpretation of the EEG. This aligns with the fundamental principles of neurophysiology and the basis of neurodiagnostic testing, ensuring that the technologist is interpreting the data based on established scientific understanding of brain electrical activity. This approach upholds the professional standard of care by ensuring that interpretations are grounded in accurate neurophysiological knowledge, which is paramount for reliable diagnostic data. Incorrect approaches analysis. One incorrect approach would be to dismiss subtle waveform variations as insignificant without a thorough understanding of their potential origins. This fails to acknowledge that even minor deviations from typical patterns can represent important physiological changes or artifacts that require careful identification and differentiation. Ethically, this represents a failure to exercise due diligence and a potential breach of the standard of care, as it could lead to overlooking critical diagnostic information. Another incorrect approach would be to attribute all observed electrical activity solely to external electrical interference, without considering intrinsic brain electrical phenomena. While external artifacts are a concern, a comprehensive understanding of brain electrical activity necessitates considering the endogenous sources of these signals. Failing to do so can lead to misidentification of genuine neurological events as artifacts, hindering accurate diagnosis. This approach demonstrates a lack of comprehensive neurophysiological knowledge, which is a core competency for a certified neurodiagnostic technologist. A further incorrect approach would be to focus solely on the gross amplitude of the EEG signal without considering its frequency and morphology. The amplitude alone does not provide a complete picture of the underlying brain activity. Frequency and morphology are crucial for characterizing different brain states, e.g., sleep stages, alertness, and identifying specific patterns associated with neurological conditions. Neglecting these aspects leads to an incomplete and potentially misleading interpretation of the EEG data, violating the principle of thorough data analysis. Professional reasoning. Professionals should approach EEG interpretation by first establishing a baseline understanding of normal physiological electrical activity. This involves recognizing the typical frequency bands, delta, theta, alpha, beta, and their associated states of consciousness. When deviations occur, the professional reasoning process should involve a systematic evaluation of the waveform's characteristics, amplitude, frequency, morphology, location, reactivity. This evaluation should then be cross-referenced with the patient's clinical presentation and any potential artifact sources. The decision-making process should prioritize accuracy, thoroughness, and adherence to established neurophysiological principles, ensuring that all interpretations are evidence-based and contribute to reliable patient care. This systematic approach, grounded in a deep understanding of the basics of electrical activity in the brain, is essential for maintaining professional integrity and providing high-quality neurodiagnostic services. Question 3. Process analysis reveals a certified neurodiagnostic technologist is reviewing electrodiagnostic data from a patient presenting with progressive weakness and sensory disturbances in the lower extremities. The data shows reduced motor nerve conduction velocities and prolonged distal latencies in the tibial and peroneal nerves, with a significant decrease in compound muscle action potential (CMAP) amplitudes. Considering the structure and function of peripheral nerves, which interpretation best reflects the potential underlying pathology? Option A. The reduced conduction velocities are likely due to a central nervous system lesion affecting motor pathways, rather than a peripheral nerve issue. Option B. The reduced amplitudes suggest a severe axonal loss, indicating a primary neuropathy where the nerve fibers themselves are degenerating. Option C. The findings are most consistent with a primary demyelinating process affecting the peripheral nerves, leading to slowed conduction and reduced signal transmission. Option D. The prolonged distal latencies are indicative of a focal nerve entrapment at the wrist, impacting the median nerve's function. The correct answer is C. The findings are most consistent with a primary demyelinating process affecting the peripheral nerves, leading to slowed conduction and reduced signal transmission. Explanation. Scenario analysis. This scenario presents a challenge in a neurodiagnostic setting where a technologist must interpret electrophysiological findings in the context of potential peripheral nerve pathology. The difficulty lies in distinguishing between a primary peripheral nerve issue and a secondary effect of another underlying condition, requiring a thorough understanding of nerve anatomy and physiology, as well as the ability to correlate clinical presentation with electrodiagnostic data. Accurate interpretation is critical for guiding appropriate patient management and treatment. Correct approach analysis. The correct approach involves systematically evaluating the electrodiagnostic findings in relation to the known structure and function of peripheral nerves. This includes assessing nerve conduction velocities, amplitudes, and latencies, and understanding how abnormalities in these parameters reflect specific types of nerve damage, e.g., demyelination vs. axonal loss. This approach aligns with the professional standards and ethical obligations of a certified neurodiagnostic technologist to provide accurate and clinically relevant data, ensuring patient safety and optimal care by adhering to established diagnostic protocols and scientific principles. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of abnormal waveforms without considering the underlying anatomical pathways or functional implications. This could lead to misinterpretation, such as attributing a finding to a peripheral nerve issue when it is actually a central nervous system artifact or a technical error. This failure to apply fundamental knowledge of peripheral nerve structure and function violates the technologist's duty of care and professional competence. Another incorrect approach would be to disregard the patient's clinical history and symptoms, relying exclusively on electrodiagnostic results. Peripheral nerve function is intimately linked to the patient's overall health status. Ignoring clinical context can lead to a diagnosis that is not supported by the patient's presentation, potentially resulting in inappropriate treatment or delayed diagnosis of the true underlying cause. This demonstrates a lack of holistic patient assessment, which is a cornerstone of ethical practice. A third incorrect approach would be to overinterpret findings or extrapolate beyond the scope of the electrodiagnostic study. For example, suggesting a specific etiology for the nerve dysfunction without sufficient evidence from the study or clinical information. This overreach can mislead clinicians and negatively impact patient care, representing a failure to maintain professional boundaries and provide objective, evidence-based data. Professional reasoning. Professionals should approach such scenarios by first reviewing the patient's clinical presentation and history. This is followed by a meticulous examination of the electrodiagnostic data, correlating specific findings with the known anatomy and physiology of the peripheral nerves being tested. A systematic comparison of the electrodiagnostic results against established normative values and patterns of nerve injury is essential. If discrepancies or ambiguities arise, further investigation or consultation with a qualified physician is warranted. This methodical, evidence-based approach ensures diagnostic accuracy and upholds the highest standards of patient care. Question 4. Strategic planning requires a neurodiagnostic technologist to consider how to proceed when a patient, exhibiting symptoms suggestive of brainstem dysfunction and cranial nerve involvement, clearly refuses a scheduled electroencephalogram (EEG) that is critical for their diagnosis, stating they don't want to be bothered. Option A. Accept the patient's refusal without further inquiry, document it, and leave the examination room, assuming the patient has the right to refuse any procedure. Option B. Proceed with the EEG as scheduled, explaining to the patient that it is a necessary test for their condition and that their refusal cannot be accommodated. Option C. Attempt to convince the patient to undergo the EEG by emphasizing the potential benefits and minimizing any discomfort they might experience, regardless of their stated reason for refusal. Option D. Politely acknowledge the patient's statement, document the refusal, and immediately inform the ordering physician to assess the patient's capacity and discuss alternative diagnostic strategies. The correct answer is D. Politely acknowledge the patient's statement, document the refusal, and immediately inform the ordering physician to assess the patient's capacity and discuss alternative diagnostic strategies. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential conflict between a patient's expressed wishes and the technologist's ethical and professional obligations. The technologist is faced with a situation where a patient, who may be experiencing cognitive impairment due to their neurological condition, is refusing a diagnostic procedure that is medically indicated for assessing critical brainstem and cranial nerve function. The technologist must balance patient autonomy with the duty to provide competent care and ensure patient safety, all while adhering to professional standards and regulatory guidelines. Correct approach analysis. The correct approach prioritizes patient safety and ethical care by seeking to understand the patient's refusal and involving appropriate personnel. This aligns with the fundamental ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also respects patient autonomy to the extent possible while acknowledging potential limitations due to their condition. By involving the physician, the technologist ensures that the patient's capacity to refuse is properly assessed and that the decision is made within a medically and ethically sound framework. This approach upholds the professional standard of care, which mandates that neurodiagnostic procedures are performed when indicated, and that patient well-being is paramount. It also implicitly follows guidelines that require technologists to operate within their scope of practice and to escalate concerns regarding patient capacity or safety to the appropriate medical authority. Incorrect approaches analysis. One incorrect approach involves proceeding with the test despite the patient's clear refusal. This violates the principle of patient autonomy and could be considered battery if performed without valid consent. It also disregards the potential for the patient's refusal to stem from a valid concern or a misunderstanding that could be addressed. Ethically, this is a significant failure to respect the individual. Another incorrect approach is to immediately abandon the test and leave the patient without further assessment or communication. A respecting refusal is important. A complete abandonment without attempting to understand the reason or involve the medical team fails the duty of care. The technologist has a responsibility to explore the situation further, especially when the refusal might be influenced by the very neurological condition being investigated. This approach neglects the principle of beneficence and the technologist's role in facilitating appropriate diagnostic pathways. A third incorrect approach is to attempt to persuade the patient through coercion or by downplaying the risks or importance of the test. This undermines the informed consent process and can be ethically manipulative. It fails to acknowledge the patient's right to make decisions about their own body, even if those decisions are not what the medical team believes to be optimal. This approach also risks damaging the patient-provider relationship. Professional reasoning. Professionals in neurodiagnostics should employ a decision-making process that begins with assessing the situation and identifying potential ethical conflicts. This involves recognizing the patient's right to refuse, but also considering the implications of their neurological condition on their capacity to make such a refusal. The next step is to gather information by attempting to understand the patient's reasons for refusal. If the refusal appears to be based on misunderstanding, fear, or potential cognitive impairment, the professional should escalate the situation to the physician or other appropriate medical personnel. This ensures that the patient's capacity is formally assessed and that a collaborative decision is made regarding the necessity and appropriateness of the test. Throughout this process, maintaining clear communication, respecting the patient's dignity, and adhering to established protocols are crucial. Question 5. Compliance review shows a certified neurodiagnostic technologist has documented an EEG recording with the presence of generalized, brief, symmetric bursts of 3 Hz spike and wave discharges. The technologist's report notes these discharges are typical of absence seizures. Based on the regulatory framework for certified neurodiagnostic technologists, which of the following interpretations of this waveform's significance is most aligned with best professional practice? Option A. The 3 Hz spike and wave discharges are a common artifact and should be disregarded unless the patient exhibits overt clinical symptoms during the recording. Option B. The technologist should focus on identifying any focal abnormalities and consider the generalized spike and wave discharges as a secondary finding, as focal abnormalities are generally of greater immediate clinical concern. Option C. The observed 3 Hz spike and wave discharges are a hallmark of absence seizures, and in the absence of other significant findings, the technologist's interpretation is sufficient for diagnostic purposes. Option D. The technologist should document the presence of generalized, brief, symmetric bursts of 3 Hz spike and wave discharges and correlate these findings with the patient's clinical presentation, noting that while highly suggestive of absence seizure, other differential diagnoses should be considered by the interpreting physician. The correct answer is C. The observed 3 Hz spike and wave discharges are a hallmark of absence seizures, and in the absence of other significant findings, the technologist's interpretation is sufficient for diagnostic purposes. Explanation. Scenario analysis. This scenario presents a common challenge in neurodiagnostic technology, interpreting complex EEG waveforms and determining their clinical significance in the context of patient presentation and potential underlying pathology. The challenge lies in accurately identifying subtle waveform abnormalities and understanding their implications, which directly impacts patient care and diagnostic accuracy. The technologist must exercise critical judgment, integrating knowledge of normal and abnormal EEG patterns with the patient's clinical status, while adhering to established protocols and regulatory guidelines. Correct approach analysis. The correct approach involves a thorough and systematic analysis of the EEG recording, correlating observed waveforms with the patient's clinical presentation and medical history. This aligns with the fundamental principles of neurodiagnostic practice, emphasizing accurate data acquisition, interpretation, and reporting. Regulatory frameworks for neurodiagnostic technologists, such as those governed by the American Board of Registration of Electroencephalographic and Evoked Potential Technologists, ABRET, for the Certified Neurodiagnostic Technologist, CNT, exam, mandate a comprehensive understanding of EEG waveforms and their significance. Best professional practice dictates that the technologist should identify and document any deviations from normal patterns, such as specific types of epileptiform discharges or focal slowing, and consider their potential clinical correlates. This ensures that the interpreting physician receives a complete and accurate picture for diagnosis and treatment planning. Incorrect approach is analysis. One incorrect approach would be to solely focus on identifying the most prominent waveform abnormality without considering its context or potential for misinterpretation. This could lead to over- or underdiagnosis, failing to meet the standard of care, and potentially violating guidelines that require a comprehensive assessment. For instance, mistaking normal physiological variants for pathological activity or vice versa demonstrates a lack of nuanced understanding, which is a failure in professional competency. Another incorrect approach would be to disregard subtle but potentially significant waveform changes because they do not immediately present as a dramatic abnormality. This oversight could lead to misdiagnoses of serious neurological conditions. Regulatory expectations for CNTs include a keen eye for detail and the ability to recognize early or subtle signs of pathology, as outlined in competency standards that emphasize thoroughness and accuracy. A third incorrect approach would be to interpret waveforms based on anecdotal experience or personal bias, rather than established neurophysiological principles and evidence-based guidelines. This subjective interpretation is contrary to the objective and standardized approach required in neurodiagnostics, potentially leading to inconsistent and unreliable results, which would be a direct contravention of professional conduct and quality assurance standards. Professional reasoning. Professionals should approach EEG interpretation by first ensuring proper electrode placement and signal quality. They should then systematically review the entire recording, paying attention to background rhythms, transient events, and focal or generalized abnormalities. This review should be guided by an understanding of normal EEG maturation and variations. Crucially, the technologist must correlate their findings with the patient's clinical information, including age, symptoms, medications, and any concurrent events during the recording. If uncertainty exists, consulting with a senior technologist or the interpreting physician is a critical step in the decision-making process, ensuring patient safety and diagnostic integrity. This iterative process of observation, correlation, and consultation is the hallmark of responsible neurodiagnostic practice. Question 6. Process analysis reveals that during the setup for an electroencephalogram (EEG) recording, the impedance readings for several electrodes are at the higher end of the acceptable range specified by the equipment manufacturer, though still technically within the general limits. The technologist has confirmed the electrodes are properly applied, and the scalp preparation is adequate. What is the most appropriate course of action to ensure optimal data quality and patient safety? Option A. Consult the specific troubleshooting guide for the EEG equipment and contact the manufacturer's technical support or a biomedical engineer for guidance on the elevated impedances. Option B. Proceed with the EEG recording, documenting the impedance readings and the steps taken for scalp preparation. Option C. Ignore the impedance readings as they are within the manufacturer's general acceptable range and proceed with the recording to avoid delaying patient care. Option D. Immediately attempt a full system recalibration of the EEG amplifier and recording unit based on general troubleshooting principles. The correct answer is B. Proceed with the EEG recording, documenting the impedance readings and the steps taken for scalp preparation. Explanation. Scenario analysis. This scenario presents a common challenge in neurodiagnostic technology, ensuring equipment is functioning optimally and safely for patient care, especially when faced with a potential discrepancy. The technologist must balance the need for timely patient testing with the imperative of accurate and reliable data acquisition. The challenge lies in interpreting subtle deviations and making an informed decision about proceeding with a study or delaying it for further investigation, all while adhering to established protocols and regulatory standards. Correct approach analysis. The correct approach prioritizes patient safety and data integrity, which are paramount in neurodiagnostic testing. Following manufacturer guidelines for calibration and troubleshooting ensures that the equipment operates within its specified parameters. This aligns with regulatory requirements for maintaining equipment in good working order and adhering to established quality control measures. By documenting the issue and seeking expert assistance, The technologist demonstrates due diligence and a commitment to providing high-quality diagnostic information, thereby upholding professional ethical standards and regulatory compliance. Incorrect approach is analysis, proceeding with the study without addressing the impedance discrepancy, despite it being within the acceptable range according to the manufacturer's general specifications, risks generating artifact-laden data. This could lead to misinterpretation by the interpreting physician, potentially impacting patient diagnosis and treatment. This approach fails to uphold the principle of providing accurate and reliable data, which is a core ethical and regulatory expectation. Attempting to recalibrate the equipment without first consulting the manufacturer's troubleshooting guide or seeking assistance from a qualified biomedical engineer could lead to improper adjustments. This might exacerbate the problem or create new ones, compromising equipment performance and potentially leading to inaccurate readings. This bypasses established protocols for equipment maintenance and troubleshooting, which are often mandated by regulatory bodies to ensure safety and efficacy. Ignoring the impedance discrepancy entirely because it falls within a broad acceptable range, without further investigation, is a failure to recognize that even minor deviations can sometimes indicate underlying issues that may worsen or affect signal quality. This approach neglects the technologist's responsibility to critically evaluate all aspects of the equipment's performance and to ensure the highest possible data quality for patient care. It may violate implicit or explicit quality assurance standards that require investigation of any unusual readings or equipment behavior. Professional reasoning. Professionals should adopt a systematic approach to equipment management. This involves understanding manufacturer specifications, adhering to established calibration and maintenance schedules, and critically evaluating all equipment performance parameters before each study. When deviations occur, the professional should consult relevant documentation, troubleshoot systematically, and seek expert assistance when necessary. Documentation of all actions taken, including any deviations from standard procedures and the rationale behind them, is crucial for accountability and quality assurance. Question 7. The monitoring system demonstrates a significant change in the patient's evoked potentials, suggesting a potential disruption in a critical neural pathway. Considering the patient's recent surgical intervention aimed at improving motor function, how should the neurodiagnostic technologist best contribute to the patient's learning and recovery process in this situation? Option A. Focus on recalibrating the monitoring equipment to ensure data accuracy, assuming the change is a technical artifact. Option B. Discuss the findings with a colleague in another department to gauge their opinion before reporting to the primary care team. Option C. Document the change in the patient's chart and wait for the physician to request further information or analysis. Option D. Immediately report the change to the attending physician and the rehabilitation team, providing a detailed interpretation of the findings in relation to the surgical goals and potential impact on motor recovery. The correct answer is D. Immediately report the change to the attending physician and the rehabilitation team, providing a detailed interpretation of the findings in relation to the surgical goals and potential impact on motor recovery. Explanation. This scenario is professionally challenging because it requires the neurodiagnostic technologist to balance immediate patient care needs with the long-term implications of learning and recovery. The technologist must interpret complex physiological data, understand its relevance to the patient's neurological state, and communicate this information effectively to the interdisciplinary team. The pressure to make timely decisions in a critical care setting, while also considering the patient's potential for rehabilitation and functional improvement, demands a high level of clinical judgment and ethical awareness. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the patient's neurophysiological status in the context of their recovery trajectory. This involves not only accurate data acquisition, but also proactive engagement with the healthcare team to integrate findings into the patient's overall care plan. This aligns with the ethical obligation to promote patient well-being and recovery, as well as the professional responsibility to contribute meaningfully to interdisciplinary decision-making. Adherence to established protocols for neurodiagnostic monitoring and clear, concise communication are paramount. An incorrect approach that focuses solely on the immediate technical aspects of data acquisition, without considering its implications for learning and recovery, fails to meet the professional standard. This could lead to missed opportunities for optimizing rehabilitation strategies or interventions that could significantly impact the patient's long-term outcome. Ethically, this approach could be seen as a failure to act in the patient's best interest by not fully leveraging the technologist's expertise to support their recovery. Another incorrect approach that involves withholding or selectively presenting data to the team based on personal interpretation or bias represents a significant ethical and professional failure. This undermines the collaborative nature of patient care and can lead to suboptimal treatment decisions. It violates the principles of transparency and honesty in professional practice and could have serious consequences for patient safety and recovery. A further incorrect approach that prioritizes expediency over thoroughness, leading to incomplete data sets or rushed interpretations, also poses a risk. This can result in misdiagnosis or an incomplete understanding of the patient's neurological condition, hindering effective treatment planning and recovery efforts. It demonstrates a lack of diligence and commitment to providing the highest quality of care. The professional reasoning process for similar situations should involve a systematic approach. First, ensuring the technical accuracy and completeness of the neurodiagnostic data. Second, critically analyzing the data in the context of the patient's clinical presentation and known recovery patterns. Third, actively communicating findings and potential implications to the interdisciplinary team, seeking clarification and contributing to collaborative decision-making. And finally, documenting all findings and communications thoroughly. This process ensures that the neurodiagnostic technologist's role in supporting patient learning and recovery is fully realized. Question 8. Comparative studies suggest that while specific lobes of the cerebral cortex are primarily associated with distinct functions, there is significant functional overlap and interconnectedness. When interpreting neurodiagnostic data, which approach best reflects best practice for a certified neurodiagnostic technologist in assessing potential cortical dysfunction? Option A. Conclude a definitive diagnosis of specific cortical pathology based on initial electrophysiological patterns observed during the study. Option B. Prioritize subjective patient descriptions of neurological deficits over objective electrophysiological measurements when identifying areas of potential cortical abnormality. Option C. Focus exclusively on the electrophysiological findings within the lobe most directly implicated by the patient's reported symptoms, assuming other areas are unaffected. Option D. Systematically evaluate electrophysiological findings across all relevant cortical regions, considering known functional localization and potential interlobe influences, to provide a comprehensive overview for physician interpretation. The correct answer is D. Systematically evaluate electrophysiological findings across all relevant cortical regions, considering known functional localization and potential interlobe influences, to provide a comprehensive overview for physician interpretation. Explanation. Scenario analysis. This scenario presents a challenge in accurately interpreting neurodiagnostic data in the context of potential cortical dysfunction. Differentiating between the functional contributions of adjacent lobes, particularly when symptoms might overlap, requires a nuanced understanding of neuroanatomy and physiology. The technologist must rely on established best practices and regulatory guidelines to ensure the integrity and diagnostic value of the acquired data. Correct approach analysis. The correct approach involves systematically evaluating the electrophysiological findings in relation to the known functional localization of the cerebral cortex. This aligns with the certified neurodiagnostic technologist's responsibility to acquire and present data that accurately reflects neurological activity. Adherence to established protocols and an understanding of how specific cortical regions contribute to various neurological functions are paramount. This approach ensures that the data collected is relevant to the clinical question and supports accurate diagnostic interpretation by the physician, fulfilling the technologist's role in patient care as outlined by professional standards and regulatory bodies governing neurodiagnostic practice. Incorrect approaches analysis. One incorrect approach would be to focus solely on a single lobe without considering the potential involvement or influence of neighboring areas. This fails to acknowledge the interconnectedness of cortical functions and could lead to an incomplete or misleading assessment. Ethically, this represents a failure to provide a comprehensive evaluation, potentially hindering accurate diagnosis and patient management. Regulatory frameworks emphasize thoroughness and accuracy in data acquisition and preliminary analysis. Another incorrect approach would be to overemphasize subjective patient reports without correlating them with objective electrophysiological findings. While patient history is crucial, the technologist's primary role is to objectively measure and record neurological activity. Ignoring or misinterpreting the objective data in favor of subjective input would be a deviation from best practice and could compromise the diagnostic process. This could be seen as a failure to adhere to the scientific rigor expected of a certified technologist. A further incorrect approach would be to make definitive diagnostic conclusions based on limited or ambiguous findings. The certified neurodiagnostic technologist's role is to acquire and prepare data for interpretation by a qualified physician. Prematurely diagnosing or attributing specific pathologies without comprehensive physician review is outside the scope of practice and violates professional boundaries and regulatory expectations. Professional reasoning. Professionals should approach such scenarios by first reviewing the patient's clinical history and the specific neurodiagnostic study being performed. They should then apply their knowledge of cerebral cortex anatomy and function to anticipate potential findings. During data acquisition and review, they must systematically assess all relevant cortical areas, considering the functional overlap and interdependencies between lobes. Any observed abnormalities should be documented meticulously, noting their location and characteristics. Crucially, the technologist must maintain professional boundaries, presenting objective findings and avoiding diagnostic pronouncements, thereby ensuring the data is accurately and ethically conveyed for physician interpretation. Question 9. Assessment of a patient's preparation for an electroencephalogram, EEG, reveals significant anxiety and claustrophobia. The patient expresses reluctance to have the cap and electrodes applied, stating they feel trapped and can't breathe. The technologist needs to proceed with the EEG to obtain diagnostic data. What is the most appropriate initial approach to prepare this patient for the procedure? Option A. Gently explain the purpose of the EEG and the electrode placement process in simple terms. Demonstrate the equipment and offer the patient a choice in the order of electrode application or the use of a small fan for air circulation. Option B. Immediately contact the physician to request a mild sedative for the patient before proceeding with electrode application. Option C. Proceed with applying the electrodes as quickly as possible to minimize the time the patient feels confined. Option D. Inform the patient that the procedure is necessary and they must cooperate, otherwise the study will be canceled. The correct answer is A. Gently explain the purpose of the EEG and the electrode placement process in simple terms, demonstrate the equipment, and offer the patient a choice in the order of electrode application or the use of a small fan for air circulation. Explanation. Scenario analysis. This scenario presents a common challenge in neurodiagnostic technology, balancing patient comfort and cooperation with the technical requirements of an electroencephalogram EEG. The patient's anxiety and claustrophobia are significant factors that can compromise data quality and the patient's well-being. A technologist must employ a range of strategies to mitigate these issues while ensuring the EEG can be performed effectively and safely. Professional judgment is required to assess the patient's level of distress and adapt the preparation process accordingly, adhering to established protocols and ethical considerations. Correct approach analysis. The correct approach prioritizes patient comfort and trust building through clear communication and gradual acclimatization. Explaining the procedure in simple terms, demonstrating the equipment, and allowing the patient to touch the electrodes can significantly reduce anxiety. Offering choices, such as the order of electrode placement or the use of a fan for ventilation, empowers the patient and fosters a sense of control. This aligns with the ethical principle of patient autonomy and the regulatory requirement to obtain informed consent, which implicitly includes ensuring the patient is as comfortable and cooperative as possible to understand and agree to the procedure. It also directly supports the goal of obtaining high-quality neurodiagnostic data by minimizing artifacts caused by patient movement or distress. Incorrect approaches analysis. One incorrect approach involves proceeding with electrode application without adequately addressing the patient's stated anxiety. This disregards the patient's expressed discomfort and can lead to increased distress, potential refusal to complete the study, or significant artifacts that render the EEG data unusable. This failure violates the ethical duty of care and potentially the regulatory requirement for patient cooperation through understanding and consent. Another incorrect approach is to dismiss the patient's concerns as minor and proceed with a standard, potentially rapid, application of electrodes. This demonstrates a lack of empathy and fails to recognize that claustrophobia can be a serious impediment to the procedure. It neglects the technologist's responsibility to adapt their practice to individual patient needs, which is a cornerstone of professional neurodiagnostic practice and often implicitly or explicitly covered in regulatory guidelines regarding patient care standards. A further incorrect approach is to administer a sedative without a physician's order or a clear indication of severe, unmanageable anxiety. This bypasses established medical protocols, potentially poses risks to the patient, and is outside the scope of practice for a neurodiagnostic technologist. It represents a significant regulatory and ethical breach, as it involves medical intervention without proper authorization and assessment. Professional reasoning. Professionals should approach patient preparation by first actively listening to and acknowledging the patient's concerns. The next step is to assess the severity of the anxiety and its potential impact on the procedure. Based on this assessment, the technologist should implement a tiered approach, starting with communication and reassurance, then moving to environmental adjustments and patient involvement, and only escalating to more significant interventions, like involving the physician for medication, if necessary and appropriate. This systematic, patient-centered approach ensures both the technical success of the EEG and the patient's well-being, upholding professional standards and regulatory compliance. Question 10. When evaluating a routine electroencephalogram (EEG) recording, you observe a sudden, high-amplitude rhythmic artifact that appears to be synchronized with the patient's breathing. The artifact is obscuring several seconds of posterior brain activity. What is the most appropriate immediate course of action to manage this artifact while ensuring the integrity of the neurodiagnostic data? Option A. Continue the recording as is, assuming the artifact will resolve on its own, and make a note in the patient's chart about the observed interference. Option B. Immediately stop the recording and inform the physician that the data is compromised due to significant artifact. Option C. Gently instruct the patient to try and relax their breathing and observe if the artifact diminishes, while simultaneously checking for any loose electrodes or external electrical interference near the patient. Option D. Manually filter out the artifact during the recording process to reveal the underlying brain activity. The correct answer is C. Gently instruct the patient to try and relax their breathing and observe if the artifact diminishes, while simultaneously checking for any loose electrodes or external electrical interference near the patient. Explanation. This scenario presents a common challenge in neurodiagnostic technology, distinguishing genuine physiological signals from artifact, which can lead to misinterpretation and potentially incorrect diagnosis. The technologist must possess a keen understanding of both normal neurophysiological activity and the various sources of interference. The professional challenge lies in the critical need for accurate data acquisition, as the quality of the recorded signal directly impacts the physician's ability to make informed clinical decisions. Failure to properly identify and manage artifact can result in unnecessary further testing, delayed treatment, or even inappropriate interventions, all of which have significant ethical and patient safety implications. The correct approach represents best professional practice because it prioritizes the integrity of the neurodiagnostic recording by systematically identifying the source of the artifact and implementing appropriate corrective measures without compromising the recording's diagnostic value. The technologist upholds the fundamental ethical obligation to provide accurate and reliable data. This aligns with the principles of patient care and professional responsibility inherent in neurodiagnostic practice, ensuring that the recorded data is a true reflection of the patient's neurological state. An incorrect approach that involves simply discarding the affected portion of the recording without attempting to identify or mitigate the artifact source is professionally unacceptable. This failure constitutes a breach of professional duty, as it may lead to the loss of valuable diagnostic information. Furthermore, it bypasses the technologist's responsibility to troubleshoot and optimize the recording process, potentially masking underlying issues or contributing to an incomplete or misleading study. This could be seen as a failure to adhere to established protocols for data acquisition and quality control, which are often implicitly or explicitly guided by regulatory standards for patient care and medical record integrity. Another incorrect approach, such as continuing the recording with the artifact present and hoping it resolves on its own, demonstrates a lack of proactive problem solving. This can lead to a recording that is difficult or impossible to interpret, wasting valuable patient and technologist time. Ethically, this approach fails to meet the standard of care expected in neurodiagnostic procedures, where the goal is to obtain clear and interpretable data. It also risks misinterpretation by the reviewing physician, who may not be aware of the extent or nature of the artifact. The professional reasoning process for similar situations should involve a systematic approach. 1. Observe the artifact. Note its characteristics, e.g., frequency, amplitude, morphology, timing. 2. Identify potential sources. Consider patient movement, electrical interference, electrode issues, or equipment malfunction. 3. Implement corrective actions. Systematically address each potential source, such as repositioning electrodes, shielding the patient, or checking equipment connections. 4. Reevaluate the recording. Assess if the artifact has been reduced or eliminated without compromising the physiological signal. 5. Document all actions. Maintain a clear record of the artifact, the steps taken to manage it, and the outcome. This methodical approach ensures that the technologist is actively engaged in producing high-quality data and fulfilling their professional responsibilities. Question 11. Operational review demonstrates that a certified neurodiagnostic technologist is considering incorporating techniques aimed at promoting neuroplasticity into the post-procedure care of patients recovering from specific neurological events. Which of the following represents the most ethically sound and professionally responsible approach to implementing these techniques? Option A. Introduce novel neuroplasticity techniques to patients as they are encountered, without prior formal validation or team consultation, to explore their potential benefits. Option B. Immediately begin applying various neuroplasticity-promoting exercises and stimuli to patients based on personal observation and anecdotal success in similar cases. Option C. Focus solely on routine post-procedure care and avoid any interventions related to neuroplasticity, as these are considered outside the standard scope of practice for neurodiagnostic technologists. Option D. Develop and implement a standardized protocol for promoting neuroplasticity based on current research literature, ensuring it is reviewed and approved by the multidisciplinary team before patient application. Correct answer is D. Develop and implement a standardized protocol for promoting neuroplasticity based on current research literature, ensuring it is reviewed and approved by the multidisciplinary team before patient application. Explanation. The scenario presents a challenge in applying neuroplasticity principles to patient care without a clear, evidence-based protocol. Neuroplasticity, the brain's ability to reorganize itself by forming new neural connections, is a complex phenomenon. Applying it effectively in a neurodiagnostic setting requires understanding how different interventions might influence these changes and ensuring patient safety and ethical practice. The challenge lies in translating theoretical knowledge into practical, individualized patient management within the regulatory framework governing neurodiagnostic technologists. The correct approach represents best professional practice because it prioritizes patient well-being and adheres to the ethical and regulatory standards expected of a certified neurodiagnostic technologist. This involves a systematic, evidence-based process that considers the individual patient's condition, consults with the multidisciplinary team, and documents interventions and outcomes meticulously. This aligns with the professional responsibility to provide competent and ethical care, ensuring that any interventions are safe, effective, and justified by current scientific understanding and clinical guidelines. An incorrect approach that relies solely on anecdotal evidence or unverified personal experience fails to meet the standard of care. This could lead to ineffective or even harmful interventions, violating the ethical obligation to do no harm and potentially contravening regulatory requirements for evidence-based practice. Another incorrect approach, such as implementing novel techniques without proper validation or team consultation, risks patient safety and undermines the credibility of the neurodiagnostic profession. This disregards the collaborative nature of healthcare and the importance of peer review and established protocols. Failing to document interventions and outcomes is a significant ethical and regulatory failure, hindering quality improvement, accountability, and the ability to track the effectiveness of care. Professional decision-making in such situations should involve a structured approach. First, thoroughly assessing the patient's current neurophysiological status and clinical presentation. Second, consulting relevant scientific literature and established clinical guidelines regarding neuroplasticity and its application. Third, collaborating with the treating physician and other members of the healthcare team to develop a safe and appropriate plan. Fourth, implementing the plan with careful monitoring and documentation. And finally, evaluating the patient's response and adjusting the plan as necessary, always within the scope of practice and regulatory mandates. Question 12. The performance metrics show a consistent pattern of prolonged central conduction times in motor evoked potentials, MEP, during routine spinal cord monitoring. Which of the following anatomical considerations is most critical for a neurodiagnostic technologist to evaluate when interpreting these findings? Option A. The integrity of the dorsal columns and their role in proprioception. Option B. The functional status of the corticospinal tracts and their descending pathway. Option C. The presence of demyelination in the cranial nerves. Option D. The excitability of peripheral sensory receptors in the limbs. The correct answer is A. The integrity of the dorsal columns and their role in proprioception. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a neurodiagnostic technologist to interpret subtle variations in electrophysiological data that could be indicative of spinal cord pathology. The challenge lies in accurately correlating the observed findings with the underlying anatomical structures of the spinal cord, and understanding how dysfunction in specific regions might manifest. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient care and outcomes. Careful judgment is required to differentiate normal anatomical variations or artifacts from genuine pathological changes. Correct approach analysis. The correct approach involves a thorough understanding of spinal cord anatomy, including the location and function of different tracts, e.g., corticospinal, spinothalamic, dorsal columns, and nerve roots. This knowledge allows the technologist to precisely identify which anatomical structures are likely affected based on the electrophysiological patterns observed. For example, specific patterns of latency changes or amplitude reduction in somatosensory evoked potentials, SEP, can point to involvement of the dorsal columns, while motor evoked potentials, MEP, can highlight issues with the corticospinal tract. This precise anatomical correlation is fundamental to accurate neurodiagnostic interpretation and directly supports the technologist's role in providing clinically relevant data to the interpreting physician, adhering to professional standards of practice that emphasize accurate data acquisition and preliminary interpretation based on anatomical knowledge. Incorrect approaches analysis. One incorrect approach would be to focus solely on general electrophysiological abnormalities, without attempting to localize the dysfunction to specific spinal cord tracts or segments. This fails to leverage the technologist's anatomical knowledge, leading to a less informative report and potentially missing crucial diagnostic clues. This approach is professionally deficient as it does not fully utilize the available anatomical context to refine the interpretation of the electrophysiological data. Another incorrect approach would be to overemphasize peripheral nerve findings and disregard potential central nervous system involvement, even when the electrophysiological data suggests a spinal cord origin. This demonstrates a lack of comprehensive understanding of how spinal cord pathology can influence neurophysiological signals and fails to consider the full spectrum of potential diagnoses. This is a failure to apply anatomical knowledge to the interpretation of the entire neurodiagnostic study. A third incorrect approach would be to attribute all observed abnormalities to artifacts without a systematic investigation of potential anatomical correlates. While artifact identification is crucial, a responsible technologist must first consider genuine physiological responses and anatomical localization before dismissing findings as non-physiological. This approach risks overlooking significant pathological changes due to an overly simplistic dismissal of data. Professional reasoning. Professionals should approach such scenarios by first acquiring high-quality electrophysiological data. Subsequently, they must systematically analyze this data, correlating the observed patterns with known neurophysiological responses, and critically, with the detailed anatomy of the spinal cord and its ascending and descending tracts. This involves considering the origin and pathway of the evoked potentials being measured. The technologist should then formulate a preliminary interpretation that highlights potential anatomical regions of dysfunction, providing this information to the interpreting physician. This systematic, anatomy-informed approach ensures that the neurodiagnostic study provides the most precise and clinically actionable information possible, adhering to the ethical obligation to provide competent and thorough patient care. Question 13. Upon reviewing the evoked potential data from a patient undergoing assessment for a suspected neuromuscular junction disorder, the certified neurodiagnostic technologist observes a progressive decrease in the amplitude of the compound muscle action potential (CMAP), with repetitive nerve stimulation at a slow rate. Which of the following interpretations most accurately reflects the underlying neurophysiological process related to neurotransmission that is likely occurring? Option A. A blockage of voltage-gated sodium channels in the presynaptic nerve terminal, preventing the release of neurotransmitters. Option B. An accelerated breakdown of acetylcholine in the synaptic cleft by acetylcholinesterase, reducing the availability of the neurotransmitter. Option C. An increase in the rate of acetylcholine synthesis within the presynaptic terminal, causing an overload of neurotransmitter release. Option D. A reduction in the number of functional acetylcholine receptors at the postsynaptic membrane, leading to decreased efficacy of neurotransmitter binding. Correct answer is D. A reduction in the number of functional acetylcholine receptors at the postsynaptic membrane, leading to decreased efficacy of neurotransmitter binding. Explanation. Scenario analysis. This scenario presents a challenge in a neurodiagnostic setting where a technologist must interpret electrophysiological data that may be influenced by factors affecting neurotransmission. Difficulty lies in distinguishing between true pathological changes in neuronal signaling and artifacts or physiological variations that mimic such changes. Accurate interpretation is crucial for patient diagnosis and management, and misinterpretation can lead to incorrect treatment or delayed diagnosis. The technologist must apply their understanding of neurophysiology and the specific limitations of the recording equipment and techniques. Correct approach analysis. The correct approach involves systematically evaluating the recorded signals for characteristics indicative of altered neurotransmission, such as changes in synaptic delay, amplitude, or waveform morphology, while simultaneously considering potential confounding factors. This aligns with the professional responsibility of a certified neurodiagnostic technologist to accurately acquire and interpret data according to established protocols and scientific principles. Adherence to best practices in neurophysiology ensures that findings are clinically relevant and not due to technical or physiological artifacts. This approach is ethically sound as it prioritizes patient well-being through accurate assessment and is implicitly supported by professional standards that emphasize evidence-based practice and continuous learning. Incorrect approach is analysis. One incorrect approach would be to immediately attribute any deviation from a standard waveform to a neurotransmission disorder without further investigation. This fails to acknowledge the possibility of artifacts, e.g., electrical interference, muscle activity, or normal physiological variations that can mimic pathological changes. Ethically, this represents a failure to exercise due diligence and could lead to misdiagnosis, violating the principle of beneficence. From a regulatory standpoint, it falls short of the expected standard of care for a certified technologist. Another incorrect approach would be to disregard subtle waveform changes that might suggest altered neurotransmission, assuming they are insignificant or within acceptable limits. This overlooks potential early indicators of neurological dysfunction. Such an approach could delay diagnosis and intervention, potentially harming the patient and contravening the ethical duty to act in the patient's best interest. It also fails to meet the professional obligation to thoroughly analyze all acquired data. A third incorrect approach would be to rely solely on automated analysis software without critical human oversight. While software can be a valuable tool, it may not always accurately differentiate complex neurophysiological phenomena from artifacts or subtle pathological changes. Over-reliance on automation without expert interpretation can lead to errors that a skilled technologist would identify. This approach demonstrates a lack of professional judgment and a failure to uphold the standards of practice that require critical thinking and clinical correlation. Professional reasoning. Professionals should approach such situations with a systematic, critical, and evidence-based methodology. This involves 1. thoroughly reviewing the patient's clinical history and the specific neurodiagnostic tests being performed. 2. Carefully examining the raw data for artifacts and physiological variations. 3. Correlating observed signal characteristics with known patterns of neurotransmission and potential pathological states. 4. Consulting with supervising physicians or neurologists when findings are ambiguous or suggest significant pathology. 5. Documenting all observations and interpretations meticulously. This process ensures that diagnostic conclusions are robust, ethically sound, and compliant with professional standards. Question 14. During the evaluation of an electroencephalogram EEG showing generalized slowing and increased delta activity, which of the following neurotransmitter systems is most likely to be implicated if the patient has a history of recent benzodiazepine use? Option A, dopaminergic system. Option B, GABAergic system. Option C, serotonergic system. Option D, cholinergic system. The correct answer is A, dopaminergic system. Explanation. Scenario analysis. This scenario presents a professional challenge because the neurodiagnostic technologist is tasked with interpreting complex physiological data that is directly influenced by the intricate interplay of neurotransmitters. The challenge lies in distinguishing between normal physiological variations and potential pathological states, which requires a nuanced understanding of how different neurotransmitters mediate neuronal communication and how their dysregulation can manifest in observable neurophysiological signals. Accurate interpretation is critical for informing subsequent clinical decisions and patient care, making precise understanding of neurotransmitter function paramount. Correct approach analysis. The correct approach involves correlating the observed electrophysiological patterns with the known functions of specific neurotransmitters and their receptors. This demonstrates best professional practice by applying a deep understanding of neurophysiology to the interpretation of diagnostic data. It aligns with the ethical obligation to provide accurate and reliable diagnostic information, ensuring that patient care is based on sound scientific principles. This approach is implicitly supported by professional guidelines that emphasize the importance of a comprehensive understanding of neurobiology in neurodiagnostic practice. Incorrect approaches analysis. Focusing solely on the amplitude and latency of waveforms without considering the underlying neurochemical mechanisms represents a significant failure. This approach ignores the fundamental role of neurotransmitters in generating these signals and could lead to misinterpretation of data, potentially attributing waveform changes to technical artifacts or unrelated factors when they are in fact indicative of neurotransmitter imbalances. This would violate the ethical duty to provide thorough and accurate interpretations. Attributing waveform abnormalities solely to patient movement or electrical interference without investigating potential neurochemical causes is another failure. While technical factors can influence recordings, a responsible neurodiagnostic technologist must consider all plausible explanations, including physiological ones related to neurotransmitter function. Dismissing potential neurochemical influences prematurely can lead to misdiagnoses and inappropriate patient management, contravening professional standards of care. Ignoring the potential impact of medications on neurotransmitter systems and their subsequent effect on neurophysiological recordings is a critical oversight. Many medications directly target neurotransmitter pathways. Failing to consider this interaction means the technologist is not accounting for a significant variable that can alter the neurophysiological landscape, leading to inaccurate interpretations and potentially misleading diagnostic reports. This demonstrates a lack of comprehensive understanding required for the role. Professional reasoning. Professionals should approach neurodiagnostic data interpretation by first establishing a baseline understanding of the expected physiological responses. They must then consider all potential contributing factors, including technical, physiological, and pharmacological influences. A systematic approach involves correlating observed data with established neurophysiological principles, including the roles of neurotransmitters. When abnormalities are detected, a thorough investigation should be conducted, considering differential diagnoses and consulting relevant literature or senior colleagues when necessary. This iterative process of observation, hypothesis generation, and validation ensures the highest quality of diagnostic interpretation. Question 15. The evaluation methodology shows a patient referred for polysomnography due to complaints of excessive daytime sleepiness and fragmented nocturnal sleep, with a history of shift work. To optimize the diagnostic yield and ensure accurate interpretation of the polysomnographic data, which of the following scheduling considerations is most critical for addressing potential circadian rhythm influences? Option A. Scheduling the polysomnography at the earliest available appointment slot to expedite diagnosis, regardless of the patient's typical sleep-wake cycle. Option B. Scheduling the polysomnography during the day to capture a nap study, as this is often more convenient for technologists. Option C. Relying solely on the patient's subjective report of feeling tired to determine the optimal time for the study. Option D. Scheduling the polysomnography during the patient's habitual sleep period, taking into account their reported chronotype and recent work schedule. The correct answer is D. Scheduling the polysomnography during the patient's habitual sleep period, taking into account their reported chronotype and recent work schedule. Explanation: the evaluation methodology shows a patient presenting with suspected sleep-related breathing disorders and daytime somnolence. A key challenge in neurodiagnostic testing for such conditions is accurately assessing the impact of circadian rhythm disruptions on sleep architecture and physiological responses. The technologist must optimize the testing protocol to account for the patient's natural sleep-wake cycle, which can significantly influence the interpretation of polysomnographic data. Failure to consider circadian factors can lead to misdiagnosis or incomplete understanding of the underlying pathology. The correct approach involves meticulously documenting the patient's habitual sleep schedule and chronotype, and then scheduling the polysomnography, PSG, to align with the patient's typical sleep period, or a period that specifically aims to capture a disrupted circadian phase, if that is the suspected pathology. This ensures that the recorded data reflects the patient's usual sleep patterns or a targeted investigation of their circadian dysfunction. Adherence to established guidelines for sleep studies, such as those from the American Academy of Sleep Medicine (ASM), which implicitly or explicitly address the importance of recording during the patient's habitual sleep times, is paramount. This practice aligns with the ethical obligation to provide accurate and comprehensive diagnostic information, ensuring patient safety and effective treatment planning. An incorrect approach would be to schedule the PSG at a time convenient for the facility without considering the patient's circadian rhythm, such as a standard daytime nap study for a patient with suspected nocturnal issues. This disregards the physiological impact of circadian timing on sleep stages, respiratory events, and autonomic function, potentially leading to a false negative or misleading study. This failure to optimize the testing environment and timing based on the patient's biological clock constitutes a deviation from best practice and could be considered a breach of professional responsibility to conduct a thorough and accurate evaluation. Another incorrect approach would be to solely rely on patient self-report of sleepiness without objective assessment of their circadian phase, as subjective reports can be influenced by various factors and may not accurately reflect underlying physiological rhythms. This overlooks a critical component of neurodiagnostic assessment for sleep disorders. Professional decision-making in this scenario requires a systematic approach. First, thoroughly review the patient's referral and history, paying close attention to symptoms suggestive of circadian rhythm disruption. Second, consult relevant professional guidelines, e.g., ASM, for best practices in sleep study scheduling and protocol optimization. Third, engage in clear communication with the referring physician to understand the specific diagnostic questions and to collaboratively determine the most appropriate timing for the PSG. Finally, document all decisions and rationale regarding the study protocol, including any deviations from standard practice and their justification. Question 16. Consider a scenario where a certified neurodiagnostic technologist is monitoring a patient undergoing polysomnography for suspected obstructive sleep apnea. During the study, the technologist observes several brief, subtle episodes of decreased oxygen saturation, accompanied by minor, almost imperceptible chest wall movements that are not consistently captured by the standard respiratory effort belts. The technologist also notes occasional brief arousals that are not clearly linked to overt respiratory events. What is the most appropriate risk assessment approach in this situation? Option A. Meticulously document all observed subtle events, correlate them with the physiological data, including SpO2, EC, and EEG, and communicate these detailed observations and any perceived patterns to the supervising physician for further evaluation. Option B. Rely entirely on the automated scoring system to identify and quantify all respiratory events and arousals, without further manual review or consideration of the subtle observations. Option C. Ignore the subtle chest wall movements and brief arousals, assuming they are artifacts or insignificant, and focus solely on the more obvious respiratory events for the final report. Option D. Inform the patient that these subtle findings are likely inconsequential and do not require further physician attention, thereby managing the patient's expectations without involving the physician. The correct answer is A. Meticulously document all observed subtle events, correlate them with the physiological data, including SpO2, EC, and EEG, and communicate these detailed observations and any perceived patterns to the supervising physician for further evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of subtle clinical signs and the critical need for accurate diagnosis in sleep disorders. The technologist must balance the immediate need for data acquisition with the long-term implications of a correct diagnosis for patient well-being and treatment efficacy. Failure to recognize subtle indicators or to appropriately escalate concerns can lead to delayed or incorrect diagnoses, impacting patient care and potentially violating professional standards of practice. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes patient safety and diagnostic accuracy. This includes meticulously documenting all observed events, correlating them with physiological data, and recognizing deviations from expected patterns. The technologist's responsibility extends beyond mere data collection to active interpretation and communication of significant findings to the supervising physician. This aligns with the ethical imperative to act in the patient's best interest and the regulatory requirement to maintain accurate and comprehensive patient records, ensuring that all relevant clinical information is available for diagnostic decision-making. Incorrect approaches analysis. One incorrect approach involves dismissing subtle, intermittent events as insignificant without thorough documentation and correlation. This fails to acknowledge the potential diagnostic value of these seemingly minor occurrences in sleep disorders, where subtle changes can be indicative of underlying pathology. Ethically, this constitutes a failure to exercise due diligence and professional judgment, potentially leading to an incomplete diagnostic picture. Another incorrect approach is to rely solely on automated scoring without critical human oversight. Automated systems are valuable tools. They are not infallible and may miss nuances or misinterpret artifacts. A failure to critically review and validate automated scoring against the raw physiological data and clinical observations represents a lapse in professional responsibility and a deviation from best practices in neurodiagnostic technology, potentially leading to diagnostic errors. A third incorrect approach is to withhold potentially significant observations from the supervising physician due to uncertainty or a desire to avoid perceived overreporting. This creates a communication breakdown and deprives the physician of crucial information necessary for accurate diagnosis. It violates the professional obligation to communicate effectively and transparently with the medical team, potentially jeopardizing patient care. Professional reasoning. Professionals should approach such scenarios with a mindset of proactive risk management. This involves a continuous cycle of observation, documentation, interpretation, and communication. When faced with ambiguous findings, the technologist should err on the side of caution, meticulously documenting all observations and consulting with the supervising physician. A structured approach, focusing on patient safety and diagnostic integrity, guided by established protocols and ethical principles, is paramount. This ensures that all available information is considered, minimizing the risk of diagnostic error and upholding the highest standards of patient care. Question 17. The review process indicates a need to evaluate how neurodiagnostic technologists communicate findings related to neuroplasticity to patients and referring physicians. Following a neurodiagnostic study that suggests potential for functional recovery, which approach best reflects professional responsibility and ethical practice in discussing neuroplasticity? Option A. Focus solely on the technical aspects of the neurodiagnostic study, omitting any discussion of neuroplasticity to avoid confusion. Option B. Explain to the patient that neuroplasticity means their brain can easily rewire itself, guaranteeing a full recovery with minimal effort. Option C. Inform the patient that neuroplasticity is a complex phenomenon with no guaranteed outcomes and that further research is needed before any conclusions can be drawn. Option D. Discuss the findings with the referring physician to integrate the concept of neuroplasticity into the overall treatment plan, considering the patient's specific condition and prognosis. Correct answer is B. Explain to the patient that neuroplasticity means their brain can easily rewire itself, guaranteeing a full recovery with minimal effort. Explanation. The review process indicates a need to assess how neurodiagnostic technologists understand and apply the principles of neuroplasticity in patient care, particularly when communicating findings to stakeholders. This scenario is professionally challenging because neuroplasticity is a complex, dynamic process that requires clear and accurate communication to diverse audiences, including patients, families, and referring physicians. Misinterpreting or oversimplifying neuroplasticity can lead to unrealistic expectations or inappropriate management strategies. Careful judgment is required to translate scientific understanding into practical, patient-centered information. The correct approach represents best professional practice because it emphasizes a collaborative and evidence-based communication strategy. By consulting with the referring physician and considering the patient's specific condition and goals, the technologist ensures that the information provided about neuroplasticity is accurate, relevant, and actionable. This aligns with ethical principles of patient autonomy and informed consent, as well as professional guidelines that advocate for clear communication of diagnostic findings. The technologist acts as a crucial link in the healthcare team, translating complex neurophysiological concepts into understandable terms that support optimal patient outcomes. An incorrect approach that focuses solely on the technologist's interpretation, without consulting the referring physician, fails to acknowledge the physician's ultimate responsibility for diagnosis and treatment planning. This can lead to miscommunication and potentially inappropriate patient management, violating professional standards of collaboration and patient safety. Another incorrect approach that presents neuroplasticity as a guaranteed cure or a rapid, effortless process is ethically problematic, as it creates false hope and can lead to patient disappointment and distrust. This misrepresents the scientific understanding of neuroplasticity, which is highly variable and dependent on numerous factors. An approach that dismisses the relevance of neuroplasticity to the patient's condition without a clear clinical rationale is also professionally unacceptable. It overlooks a fundamental aspect of brain function that can influence recovery and rehabilitation, potentially limiting the patient's access to beneficial interventions. Professional decision-making in such situations requires a systematic approach. First, accurately interpret the neurodiagnostic data. Second, understand the underlying neurophysiological principles, including neuroplasticity, as they relate to the patient's condition. Third, collaborate with the referring physician to contextualize the findings. And finally, communicate the information clearly and ethically to all relevant stakeholders, managing expectations appropriately. Question 18. Which approach would be most appropriate for a certified neurodiagnostic technologist when a patient undergoing polysomnography reports feeling awake during a period where the electroencephalogram EEG and other physiological signals suggest the patient is in stage N3 sleep? Option A. Adjust the scoring criteria to align with the patient's reported feeling of wakefulness, even if it contradicts standard sleep staging guidelines. Option B. Immediately conclude the recording is artifact-laden and disregard the data from that period without further investigation. Option C. Accept the patient's subjective report as definitive and score the period as wakefulness, regardless of the objective physiological data. Option D. Thoroughly review the EEG and associated physiological signals, applying established scoring criteria to objectively determine the predominant sleep stage, and document any discrepancies or challenges encountered. The correct answer is D. Thoroughly review the EEG and associated physiological signals, applying established scoring criteria to objectively determine the predominant sleep stage, and document any discrepancies or challenges encountered. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting patient data, which could lead to incorrect diagnoses or treatment plans. The technologist is faced with conflicting information regarding the patient's sleep stage, requiring them to rely on their expertise and adherence to established protocols to ensure patient safety and data integrity. The ethical imperative is to provide accurate and reliable neurodiagnostic data. Correct approach analysis. The correct approach involves meticulously reviewing the electroencephalogram (EEG) and other physiological signals to accurately identify the predominant sleep stage. This aligns with the certified neurodiagnostic technologist's responsibility to ensure the quality and accuracy of recorded data. Adherence to established scoring, guidelines, and protocols for sleep staging is paramount. This approach upholds the professional standard of care by prioritizing objective data interpretation over subjective assumptions or external pressures. It directly supports the diagnostic process by providing a reliable foundation for physician interpretation. Incorrect approaches analysis. One incorrect approach would be to rely solely on the patient's subjective report of feeling awake or asleep without objective verification. This fails to meet the professional standard of care, as subjective reports can be unreliable and do not substitute for objective physiological data. It also violates the principle of evidence-based practice, which is fundamental to neurodiagnostic technology. Another incorrect approach would be to prematurely conclude the sleep stage based on a brief observation or a single artifact. This demonstrates a lack of thoroughness and could lead to inaccurate data, potentially misguiding clinical decisions. It disregards the need for comprehensive analysis of the entire recording epoch and the characteristic patterns of different sleep stages. A third incorrect approach would be to alter the scoring criteria or disregard established guidelines to fit a preconceived notion or external suggestion. This constitutes a serious ethical breach and a failure to adhere to professional standards. It compromises the integrity of the neurodiagnostic data and undermines the trust placed in the technologist's expertise. Professional reasoning. Professionals should employ a systematic approach to data analysis, starting with a thorough review of all physiological signals. They must be proficient in applying established scoring criteria for sleep staging. When faced with ambiguity or conflicting information, they should consult relevant literature, seek guidance from experienced colleagues or supervisors, and document their decision-making process meticulously. The ultimate goal is to provide accurate, reliable, and ethically sound data to support patient care. Question 19. The audit findings indicate a pattern of inconsistent sensor placement and securement during polysomnography studies, leading to potential signal artifact and data degradation. Which of the following actions best addresses this issue to ensure diagnostic accuracy and patient safety? Option A. Reassign technologists who consistently demonstrate issues with sensor placement to less critical patient monitoring roles until their skills improve. Option B. Issue a general memo to all staff reminding them of the importance of accurate sensor placement and to be more diligent during patient hookups. Option C. Conduct a comprehensive review of polysomnography setup protocols, identify specific areas of deficiency based on the audit, and implement targeted retraining sessions for all technologists focusing on proper sensor application and artifact reduction techniques. Option D. Document the audit findings and instruct technologists to self-correct their setup techniques based on their prior training without further intervention. The correct answer is C. Conduct a comprehensive review of polysomnography setup protocols, identify specific areas of deficiency based on the audit, and implement targeted retraining sessions for all technologists focusing on proper sensor application and artifact reduction techniques. Explanation. The audit findings indicate a recurring issue with the setup of polysomnography equipment, specifically concerning the placement and securement of sensors. This scenario is professionally challenging because it directly impacts the quality and reliability of the diagnostic data collected, which in turn affects patient care and diagnosis. Ensuring proper equipment setup is a fundamental responsibility of a neurodiagnostic technologist, requiring meticulous attention to detail and adherence to established protocols. The integrity of the study hinges on accurate physiological signal acquisition, and any compromise in sensor placement can lead to artifact, missed events, or misinterpretation of sleep stages and events. The correct approach involves a thorough review of the audit findings, cross-referencing them with established best practice guidelines for polysomnography sensor placement and securement, and implementing a targeted retraining program for the technologists involved. This approach represents best professional practice because it addresses the root cause of the problem by reinforcing technical skills and knowledge. It aligns with the ethical obligation to provide competent patient care and uphold the standards of the profession. Furthermore, it demonstrates a commitment to continuous quality improvement, a key tenet in healthcare settings. Adherence to manufacturer guidelines and established protocols ensures that the collected data is valid and interpretable, leading to accurate diagnoses and appropriate treatment plans. An incorrect approach would be to dismiss the audit findings as minor or inconsequential. This is a regulatory and ethical failure because it disregards a documented deviation from expected standards, potentially jeopardizing patient safety and data integrity. It also fails to acknowledge the technologist's responsibility for accurate data acquisition. Another incorrect approach would be to implement a superficial fix, such as simply reminding technologists to be more careful without providing specific guidance or retraining. This is professionally unacceptable as it does not address the underlying knowledge or skill gaps that may be contributing to the problem, leading to a high likelihood of recurrence. It also fails to meet the professional obligation to ensure competence and quality assurance. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly understand the nature and scope of the identified issue through objective data like audit findings. Second, consult relevant professional standards, regulatory guidelines, and manufacturer instructions to establish the correct protocol. Third, identify the specific knowledge or skill deficits contributing to the problem. Fourth, develop and implement a corrective action plan that may include retraining, protocol revision, or enhanced supervision. Finally, establish a system for ongoing monitoring and evaluation to ensure the problem is resolved and does not recur, thereby upholding the highest standards of patient care and professional practice. Question 20. Compliance review shows that a neurodiagnostic technologist is performing nerve conduction studies on a patient with suspected carpal tunnel syndrome. The technologist is evaluating the median nerve at the wrist and elbow. Which of the following interpretations of the electrophysiological findings would most accurately reflect a primary demyelinating process affecting the median nerve at the wrist, consistent with the pathophysiology of carpal tunnel syndrome? Option A. A significant increase in the sensory nerve action potential, SNAP, amplitude with a significant reduction in the sensory nerve conduction velocity, SNCV. Option B. A significant reduction in the sensory nerve conduction velocity, SNCV, with a relatively preserved sensory nerve action potential, SNAP, amplitude. Option C. A significant reduction in the sensory nerve action potential, SNAP, amplitude with a relatively preserved sensory nerve conduction velocity, SNCV. Option D. A significant reduction in both the sensory nerve action potential, SNAP, amplitude, and the sensory nerve conduction velocity, SNCV. Correct answer is C. A significant reduction in the sensory nerve action potential, SNAP, amplitude with a relatively preserved sensory nerve conduction velocity, SNCV. Explanation. Scenario analysis. A neurodiagnostic technologist is tasked with performing nerve conduction studies, NCS, on a patient presenting with symptoms suggestive of peripheral neuropathy. The challenge lies in accurately identifying the specific nerve segments affected and differentiating between axonal degeneration and demyelination, as these have different prognoses and treatment implications. Misinterpretation can lead to incorrect diagnoses, delayed or inappropriate treatment, and patient dissatisfaction. The technologist must possess a thorough understanding of peripheral nerve anatomy and physiology to select appropriate stimulation sites, record electrode placements, and interpret the resulting electrophysiological data within the context of the patient's clinical presentation. Correct approach analysis. The correct approach involves systematically evaluating the structure and function of the peripheral nerves by analyzing key electrophysiological parameters derived from NCS. This includes assessing nerve conduction velocity, NCV, and compound muscle action potential, CMAP, amplitudes for motor nerves, and sensory nerve action potential, SNAP, amplitudes for sensory nerves. Reduced NCVs are indicative of demyelination, affecting the speed of impulse transmission along the nerve. Decreased CMAP and SNAP amplitudes suggest axonal loss or dysfunction, impacting the overall signal strength. By correlating these findings with anatomical knowledge of the specific nerves being tested and the patient's symptoms, the technologist can accurately characterize the nature and severity of the peripheral nerve dysfunction. This aligns with the professional standard of care and the ethical obligation to provide accurate and reliable diagnostic information to guide patient management. Incorrect approaches analysis. One incorrect approach would be to solely focus on obtaining a signal without considering the underlying physiological mechanisms of nerve conduction. This might involve stimulating at arbitrary points or using standard protocols without adapting to potential anatomical variations or the specific clinical question. This fails to address the core requirement of differentiating between demyelinating and axonal processes, leading to a superficial and potentially misleading assessment. Ethically, this represents a failure to exercise due diligence and provide a comprehensive diagnostic evaluation. Another incorrect approach would be to interpret the NCS findings in isolation, without integrating them with the patient's clinical history and physical examination. For example, a mild reduction in NCV might be considered normal in certain age groups, or if the stimulation site is not optimally chosen, but could be significant if correlated with specific sensory deficits. This lack of clinical correlation can lead to misdiagnosis or overdiagnosis. Regulatory frameworks emphasize the importance of a holistic patient assessment, and ignoring clinical context is a significant professional failing. A third incorrect approach would be to rely on automated software interpretations without critical review and understanding of the underlying electrophysiological principles. While software can be a useful tool, it cannot replace the technologist's expertise in recognizing artifacts, subtle abnormalities, or atypical presentations that might not be flagged by the algorithm. This approach risks perpetuating errors and failing to identify complex neuropathies. It violates the principle of professional accountability and the responsibility to ensure the accuracy of diagnostic data. Professional reasoning. When faced with a patient presenting with peripheral neuropathy symptoms, the neurodiagnostic technologist should first thoroughly review the patient's clinical history, including the onset, location, and nature of symptoms, as well as any relevant medical conditions. Next, they should identify the specific peripheral nerves most likely to be involved based on the clinical presentation. The technologist must then select appropriate NCS protocols, ensuring correct electrode placement and stimulation parameters to accurately assess both motor and sensory nerve function. During the study, they must critically evaluate the waveforms for artifacts and abnormalities, and interpret the obtained parameters, NCV, amplitudes, in the context of normal physiological ranges and the patient's clinical findings. This systematic, integrated approach ensures the generation of accurate and clinically relevant diagnostic data.